Hello, everyone. I'm Esther Ching-Lan. Today, I'm happy to share with you my research journey. I'm a professor and adjunct nursing supervisor at Department of Nursing, NCKU Hospital, and NCKU. My research focus is severely mental illness and public mental health. Why research? I always ask myself two questions. Where is my research spirit? And what's my concern about my patient? I have a dream. That dream is to help mental illness live in their own community and live their full life. How to make this dream come true? I try my best to make this dream come true through my patient and scientific search. And I also develop pragmatic research action. My first motive for research is to help patients living in community. So I study patients' difficulties living in community and develop some comparison between several models in community in Taiwan. I have three trajectories to research on this population. We try to care for individuals with severe mental illness and help them to promote their recovery in community and improve public mental health literacy and attitude. This is our research trajectories. We examine symptom-related factors, and based on that understanding, we develop individual or family approach care models. As we examine the impact of symptom-related factors on patients with schizophrenia or bipolar disorder, we find out medication adherence, metabolic syndrome, internalized stigma will influence our patients' illness management. Also, their family illness perception will influence. So we try to decrease the barriers of recovery in community. We realized public attitude will influence their recovery in community. So we provide auditory hallucination simulation for nursing students and provide recovery patient as an educator. Such kind of intervention will help our patients to have better recovery in community. Let's take an example to show you how we translate research into practice. As we examine the symptom-related factors on bipolar disorder patients, we identify illness perception, social reason stability, sleep, internalized stigma will influence our patients' symptoms. So based on that, we develop our evidence-based intervention. Let's call interpersonal and social reason therapy. We also collaborated with other disciplines to develop more early recognition model via smartphone sensor application. So because illness perception and social reason could impact most symptoms, a cognitive behavioral intervention could emphasize to cultivate a favorable perception about their understanding and the controllability, to challenge their unfavorable illness perception about negative consequence and concern, and to increase their awareness and learn strategy for maintaining their social reason stability. So based on that understanding, we develop our evidence-based care models for our patients. In NCKU Hospital, we call that Cheng group. It's a nurse-led psychoeducation program we call Balancing My Swing. It's a cognitive behavioral strategy and interpersonal social reason therapy to combine to enhance our patients' positive cognition as well as adaptive behavior relevant to maintaining their daily and nightly routine. This nurse-led Balancing My Swing program including 5 elements. We try to provide in scientific knowledge to our patients. We help our patients effectively taking their medication and stabilizing their social rhythm, dealing with interpersonal conflict, and managing their mood swing and recovery. So I would like to acknowledge Ministry of Science Technology. They support us many years grant. We got their support in a long-term grant. So I appreciate they so much. I also appreciate my colleagues in NCKU and NCKU hospital and clinical team, research team, and all my students. Thank you so much.